Thinking of working abroad as a healthcare professional? Let's help you with that. Hi, my name is Jeremiah from Abba. You've got questions, we've got answers. Welcome to Ask Abba, a segment where we break down the ins and outs of overseas application process. I'm Jeremiah Cabreros, a recruitment specialist at Abba. And today, I'll be answering some of the most frequently asked questions and clearing up common misconceptions about working as a nurse in Guam. Guam is becoming a popular stepping stone for Filipino nurses who want to start working overseas. But while the opportunity sounds great at first, especially when people hear US territory, there's also a lot of confusions, assumptions, and half-truth floating around. Some think working in Guam is like working in the United States. Others believe it's a shortcut to permanent residency. And certain individuals assume it's the best options for those who haven't passed the NCLEX yet. But the truth is, what looks easy now might make things harder later if you're not fully informed. That's why in this episode, we're slowing things down a bit and clearing up the biggest misconceptions around Guam. Let's start with the most common question. Question number 1. Is Guam really just like US when it comes to work and visa processing? This is an interesting question. First things first, Guam is a US territory, but that doesn't mean it operates exactly like California, Texas, or New York. In terms of immigration and visas, Guam follows the same process as the US. Most nurses going there are deployed through EB3 immigrant visa, which gives you a pathway to permanent residency, and even allows you to bring your family eventually. So it's definitely not a temporary role or a short-term contract. You are applying for a full US RN position just based in Guam. What makes Guam unique is the setting. Think of it as a US healthcare system with an island lifestyle. It's smaller, calmer, and a little closer to home. Literally, Guam is just 3 to 4 hours away from the Philippines, which makes it easier to visit family or adjust to living abroad. Let's talk about something pretty cool. One of our main employers in Guam is GRMC, or Guam Regional Medical City. What makes it even more interesting is that it's actually a sister company of the medical city here in the Philippines. So if you've worked with or familiar with TMC, the healthcare environment at GRMC will feel very familiar and easy to adjust to. And here's the best part, you won't feel like a stranger in Guam. A large portion of the nurses there are Filipinos, which means you'll be surrounded by a supportive community that shares your background and values. It makes the whole experience less intimidating and a lot more comforting. It's that rare mix where you get to grow your career in a US healthcare setting, while feeling close to home. Professional development with a familiar vibe? Definitely the best of both worlds. Question number 2. Do I have to pass the NCLEX before applying to Guam? This one's a hot topic talaga, especially when it comes to Guam. If you're eyeing roles where you can fully practice your profession as a nurse, passing the NCLEX is key. Most employers like GRMC look for nurses who are already NCLEX passers, have at least 2 years of bedside experience, and no more than 1 year of work gap. The NCLEX isn't just a requirement, it's your ticket for better roles, higher pay, and more opportunities to use your full skill set as an RN. It shows you're ready, qualified, and serious about building your career abroad. So if you're planning to work in Guam or similar destinations, make your NCLEX a top priority. It sets you apart and puts you on the right track. Question number 3. Can I easily switch employers in Guam if I'm there on an EB3 visa? Honestly, it's not that easy. If you're working under an EB3 visa, your visa is tied to the employer who sponsored you. So you can't just quit and start working somewhere else right away. The new employer has to officially take over your visa sponsorship, which means there's paperwork and waiting for approval before you can start. If you're thinking about moving to a new job, just make sure to check your contract. Talk to your agency or someone who knows about visa. Question number 4. What are the usual benefits of working in Guam? Aside from the obvious benefit of earning a competitive salary, usually ranging from $31 to $67 per hour, depending on your experience, Guam also offers some unique perks. For starters, some employers like JRMC provide free accommodation for the first 30 days, which is a big help when you're just getting settled. The overtime pay and annual leave benefits are also solid, giving you a good work-life balance. Guam's island environment is another bonus for many nurses. Imagine finishing your shift and heading straight to the beach, or enjoying local island food during your days off. It's a refreshing lifestyle compared to the hustle of big city hospitals. Working in Guam also means gaining US-related clinical experience, which can strengthen your resume whether you choose to stay or move to the mainland later on. And let's not forget the immigrant visa processing assistance. While it doesn't happen instantly, it opens a pathway that many nurses haven't considered yet. Question 5. Can I move to the US after working in Guam? Technically, yes. And this is a common misconception. A lot of people think working in Guam is a dead end, but that's not true at all, especially if you're hired under the EB3 visa. Like we mentioned earlier, the EB3 gives you a pathway to US permanent residency. So once you finish your contract in Guam, you're free to explore job opportunities in the mainland US. There's no need to reapply, and because Guam follows US clinical standards, your experience there is recognized and can even give you an edge when applying to hospitals in other states. We've seen nurses do exactly that. They start in Guam, get used to the US healthcare system, and then transition to bigger cities once they're ready, all while keeping their green card and moving their career forward. If working in Guam as a nurse sounds like something you're interested in, here's some big news. Our employer, Guam Regional Medical City, or JRMC, will be holding a face-to-face recruitment event this September 2 and 3, here in our Mandaluyong office. So if you're currently working in these areas and have these qualifications, you may start your application by scanning the QR code. Even better, interview results will be released the same day. So if you think you're qualified, send us your application today. Who knows, this could be the first step towards something big in your nursing career. So that's all the questions for today's Ask Abba. Thanks for watching. But if you got more questions, drop them on the comments or DM us. We might just feature them in the next episode. Don't forget to like, subscribe, and hit that notification bell so you don't miss what's next.